Well, if you could picture this, it's 1977. We're just about to enter a renaissance of modern medicine. We're in early heart transplantation days. We're early in immunological sciences. We're early in neurobiology, molecular biology. And I'm training in pathology in the basement of Albert Einstein Hospital. And then around the autopsy table, two giants of pathology, Drs. Angrist and Popper, are sitting on bar stools, examining individual organs in their gloveless hands through very, very thick glasses. They're both 75 and up in age, 75 years and older, sometimes using magnifying glasses, refusing to look at the organs under the microscope, refusing to use the powerful electron microscopes next door. And they're analyzing the structure, analyzing the clinical history, and taking the power of inquiry to another level. This vision of having these two giants, both of which written many textbooks of pathology, has stayed with me to this day. And now you can flash forward around 5-6 years later. I'm the last year of cardiology fellowship. And we have a series of fellows, cardiology, pulmonology, endocrinology, critical care medicine, all responsible to take care of a cohort of people living in a large set of apartment buildings across from the main Johns Hopkins campus. Now, when we're taking care of these folks, it is an outpatient clinic setting, and we are working with 2 physician's assistants. We don't have any expensive equipment. We don't have access to the main hospital unless we truly needed it, because we had a set of resources that we had to live with. And so we had to use and integrate all of our knowledge. We had to talk to each other. We had to use the power of our observation, and we had to take really, really in-depth clinical histories, because we didn't have the option of ultrasounding everyone. We didn't have the option of doing CAT scans on everyone or MRI scans. We just didn't have those options. That image stays with me. And then you flash forward another 15 years. I'm in Bihar, India. Bihar, India is the poorest state of India. I'm working at the Institute for One World Health, the group that I co-founded. And we're at the village level in rural India, and we're in a hospital. The hospital is so primitive that many of us would faint if we were there. And yet, the hospital is awfully clean and has impeccably trained physicians. Now, these physicians don't have access to expensive equipment either, just like we didn't have in Baltimore. They have much fewer resources than I had even in Baltimore. But what they did was they used their iPhones, their cell phones, they used photography, digital photography, they used the phone to communicate with their colleagues in Delhi and ask them questions. They actually practiced integrative medicine. They used herbs in Ayurvedic medicine when it was useful, and they used antibiotics when they were useful, and then they used their entire scope of medical knowledge that they had accessible to them, but they used entrepreneurial resources to get them done. That image stands by me. That is the power and the level of inquiry that I want to bring to Anatara. Keen observations, the time to ask questions, the time to discuss, the time to analyze, the time to synthesize and integrate. That's what I want Anatara to be about.